In today's Blissful Beauty segment, you know, when you're standing in line at the grocery store, you are so tempted looking at all of those magazines with the Hollywood this and that, getting all the different plastic surgery. But honestly, it's a very serious matter. Dr. Lyle with Raleigh Plastic Surgery joins us now to talk about the complications that can arise from plastic surgery. And I think we only hear when it's the awful thing like Kanye West's mother.
Right.
What happened with that, if you could just...
Well, you know, not knowing all the details, but it seemed like she had too much surgery for her health. And, you know, when you do elective surgery, cosmetic surgery, you really want to make sure it's absolutely safe. And the patients have to be screened properly. It's patient selection. If you do even very healthy patients, there can be complications. But if you take someone who maybe is diabetic, has heart problems, hasn't been fully evaluated, overweight, those are things that could lead to complications. And from my understanding, she wasn't very well screened. She didn't have a clearance from a cardiologist or a physician, you know, the non-plastic surgeon physician.
Sure, sure.
And actually, California has come up with a law now because of that.
In lieu of that?
In lieu of that. Well, in response to that, in terms of that the patients that have cosmetic surgery have to have some sort of clearance from a physician.
Mm-hmm. Now, I guess, you know, people think elective surgery and maybe in their mind like, oh, it's not serious, it's elective. Is that sort of the misconception that people need to get past, because it is still a major serious surgery you're being put under? It is.
It's big. You know, it's major trauma to the body. I don't care what it is. I don't care if it's a breast augmentation, an abdominoplasty, liposuction. You know, some of those maybe there's not real high risks, but you know, certainly you want to pick the right patient. You got to pick patients who are healthy. You know, relatively good body weight, non-smokers. You know, certainly if they have a heart problem or have any kind of issues, they have to be cleared by their, you know, a cardiologist or their internist, because there are a lot of things that can go wrong, even in the best of hands. Bleeding complications. There can be pulmonary emboli, which is blood clots forming in your legs during the surgery, especially lengthy surgeries. Some of the surgeries that we do, you know, can take 5 or 6 hours, and you're under anesthesia during that time, or you can develop blood clots in your legs. So you have to take special care to prevent that, and to be very cognizant if it does happen, because, you know, vast majority of the time people are going to do fine. But, you know, people think of cosmetic surgery, it's like you said, it's not, there can be some complications. I don't want to frighten people off, but I do think people need to know that. But people
have to use common sense.
Right.
Do you turn away patients sometimes?
Absolutely, yeah. We turn away patients. You know, one big thing is smoking. I tell people if you're smoking, you have to stop. And even if you stop, you're going to have potential complications, especially a lot of the procedures we do where, like a tummy tuck or a facelift or even some breast surgery, we're actually lifting the skin and separating it from its natural blood supply and relying on blood flow to that blood, you know.
In the recovery process?
In the recovery process, they may not heal properly.
Ooh.
Smokers have a big problem. Overweight patients, we try to select people who are, you know, not too overweight. I mean, there's certain criteria. You don't have to be perfect body mass index, but you do have to have a pretty normal weight, because there are higher complication rates with higher weights.
Now, I guess the next question I'm asking you is, the gastric bypass is such a popular surgery nowadays. And then once these people have lost all this weight, they may come to you and say, okay, I'm ready to get all this extra skin cut off.
Right.
Some of those people have had diabetes. They've had all sorts of other issues.
Right. Well, the good news about the health risks is that most of these patients that I've seen, once they've lost 100 pounds or so, they usually, a lot of times they don't have diabetes, and they don't
They've gotten rid of it.
They've gotten rid of it, so they've gotten healthier. But they still, most of them are still kind of overweight, maybe not, you know, they haven't met their goal yet. I usually want them to wait at least a year, so they've hit close to their target weight. I'll tell them, you know, you need to lose more weight before you can do this surgery. And it is big surgery. I mean, they still have risks of blood clots in their legs. You're doing lots of incisions. You know, these are not having mini tummy tucks or mini procedures. They're having
large
big
pieces.
Procedures. And there's a little bit higher infection rate and, you know, things like that. But I mean, generally you can do it very safely, picking the right patient.
And I think the media has really overblown the whole plastic surgery thing. And hear these young actresses like that. I don't even know if she's an actress, that Heidi Montag woman,
Right.
just over and over and over again. I mean,
Right.
at that point, I'm starting to think, what is this plastic surgeon thinking?
Well, yeah, I think that you can overdo it. You know, the amount of time. You know, she's a young, healthy woman. She, you know, I don't think she had any problems from it. But young, healthy people, you're gonna have a lot of surgery, but you've got to limit the amount of surgery.
Because surgery is a serious,
yeah.
serious business.
Yeah, there's risks of,
Yeah.
you know, just being under anesthesia,
Sure.
although extremely safe. But yeah, there's a lot of people come in and say, I want this, 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 and this done. And I said, well, okay, let's start with, you know, the things that you care about the most, and let's stage it. You know, gastric bypass patients actually usually need about you know, 3 or 4 procedures really to get them where they want, and I may combine 2 of them at a time. But I'll have them come back after, you know, 3 months or so or later to do the other stage, just
Right.
because it's too much surgery at once.
Sure, sure. Okay, all great questions and things to consider
Yeah.
if you are considering plastic
Yep.
surgery. Dr. Law, thank you as
Thank
always.
you.
So nice to see you.
All right.
Welcome back to My Carolina Today. After you achieve your goal of weight loss, you might have to take another step to look your absolute best. Dr. Glenn Lyle from the Raleigh Plastic Surgery Center is here to tell us about surgery after weight loss. So, Dr. Lyle, who's a good candidate for getting surgery after weight loss?
Well, I think there are 2 categories in this. One is the patient who's had a gastric bypass. They've had a surgically induced weight loss. And then there's patients who go out and do it through diet and exercise and the good old-fashioned way. So there are really 2 different categories. I think anyone who has achieved better health through that has not a lot of health problems. We like to see their weight down into a range that's more into, it may still be overweight, but not into the obese or morbidly obese rate.
Okay. Are there certain parts of the body that need this more than others? I know I see a lot of people who get the arms.
Yes, yes. And
there's a photo from your
yeah,
office.
typically you'll see with fairly massive weight loss, and you see this sometimes just people with minor weight loss that have loose arms to begin with. You'll get the arms. Typically the breasts on a woman will sag quite a bit. The tummy and the thighs, and to some extent the face. You know, if we're talking about someone who's lost maybe 100 pounds through whether it's surgery or diet and exercise, they have a lot of extra skin. We call the arms the bat wings because they kind of look like little bat wings.
Yeah.
And you know, sometimes the inner thighs will really sag, and I see all kinds of differences in patients. Some patients, it just puts it all right on their tummy. I would say the average patient really wants their tummy done first. That's the thing that if you've really lost a considerable amount of weight, you're going to have most of your problems with your weight. In this picture, this patient really was not a major weight loss patient, but you know, they're going to want to look better in their clothing, look better in bathing suits and that sort of thing. So you're gonna have a lot of emphasis on the tummy first.
Wow. How, I guess, much time should you immediately go right into surgery, or does there need to be some period of time between your weight loss and getting
Right.
the surgery?
I prefer that patients, especially gastric bypass patients, they have to be at least a year after their surgery. Most people in that category have taken quite a while to sort of stabilize, and you usually don't see a stable weight for at least a year, sometimes a year and a half. Same thing with the patient who's lost a lot of weight. A lot of these people feel like they want to reward themselves for all their hard work, and let's get going, let's get that surgery done. And I agree with that, but they want to make sure they're stable. I've seen some patients who have had lots of surgery and then they come back and they get back to their old habits and it just comes back, and then they think,
Right.
what happened here? I said, well, you gained weight again. You know.
Once you have a surgery, is it something that you need to continue to come back to the office to get touch-ups, or if you follow healthy habits, should it be one and done?
Well, a lot of that depends on the weight that you started at. If you at one time were, you know, very heavy and 300 pound or so, and then you've lost 100, 150 pounds, that skin has lost its tone. And over time, and as unfortunately we continue to age, during that time your skin will continue to sag. So sometimes there are needs for little touch-ups here and there. I find that the happiest patients are patients who do part